My name is Kathleen Lisson, and I am a lymphedema therapist, and I would like to share some information with you on longevity and lymphatic disease, specifically on infection prevention. So I'm board certified in therapeutic massage and bodywork. I'm a lymphedema therapist, and I'm also the author of a book called Stress Reduction for Lymphedema. So today we're going to talk about what is not an infection. Then we're going to talk about erysipelas and cellulitis. These are the major infections that we're concerned about as lymphedema therapists. And then I'm going to give you some useful information if you have a diagnosis of lymphedema and there's knee surgery, that total knee is coming up in your medical future. So we'll start off by stating that nothing is really an absolute emergency with lymphedema other than infections. So with lymphedema, we want you to keep your swelling down. We want you to keep decongested, but it's not an absolute emergency until infection comes. And then you really do have to go to the hospital. You do have to get those antibiotics. That is what is going to reduce your lifespan and health span potentially faster than anything else that would happen with relation to lymphedema. So the important part of your lymphedema treatment is going to be compression therapy. And we know the first use of compression therapy is thought to be by Hippocrates, roughly 2,500 years ago, to treat the sequela of venous insufficiency. And fast forwarding from Greece to Italy in the present day, a publication that is it's registered with the government of Italy, titled Multi-Specialty Recommendations for the Appropriate and Affordable Lower Limb Vein Lymphatic Disorders Management. This publication has its good clinical practice statement number 8, regarding compression garment prescription, stating that it is appropriate that graduated compression for discomfort of the lower limb due to venous and or lymphatic disorders be prescribed by an experienced healthcare professional. So you can see from far back in history to the very current day, compression is indicated. And it's important for us to use compression correctly, use compression when it's prescribed, and make sure the person who is giving us the compression is an experienced healthcare professional. So let's look at what we're talking about when we talk about compression. Some examples of medical compression devices include the medical compression stockings. So the socks that many people are familiar with. There's also short stretch compression bandages. There's also adjustable compression wraps. So those are inelastic compression, sometimes called Velcro wraps. And then if there's venous disease is suspected, the thromboprophylactic stockings are also used. So when we're applying compression to people, we have some symptoms, and those are not necessarily infections. So we need to figure out whether it's a symptom of wearing compression or whether it's actually an infection, and then you need to go to the hospital and take the antibiotics. Some side effects of wearing compression include skin irritation. You can have itching. You can feel cold or warmth when you're wearing the compression, and you can have dry skin as a result of wearing compression. So these are side effects of wearing compression, and if you have any of these side effects, definitely talk to your lymphedema therapist, talk to the healthcare professional that prescribed the compression to try to figure out how you might help yourself while wearing the compression to reduce these side effects. So let's talk about the next item on the list is allergic skin reaction. It's important to make sure whether it is a true allergy or it's just due to the occlusive barrier effect of the compression material itself. So you're not necessarily allergic to something. It could be just because the compression garment itself is an occlusive barrier, and that's what causes the symptoms. Big issue that a lot of people feel is that their compression is too tight. And we need to really look deeper than just the client is telling me that the compression is too tight. Is it actually an incorrect size or an incorrect prescription of compression? Or is this just a new sensation of pressure? And the researchers in this article state it may take several days before patients get used to wearing compression. So I think there's a lot to be in the conversation around this. Is it just that this is a new compression and you've never worn a compression stocking before, and then this is just a new sensation for you? It's not necessarily too tight. It's just the sensation of actually wearing medical compression, especially if previously the person has worn things that are bought off the internet that are not necessarily graduated compression, medical grade compression. There's also the fact that a new compression garment can have a kind of breaking in period. So just getting something right out of the box, putting it right on your leg, it may feel an increased level of sensation because you may need to wash the garment a few times and wear the garment a few times and put the garment on correctly to make sure that that is the correct garment for you, whether it's an incorrect sizing or prescription, or whether we're wearing it wrong, it's too new and we haven't broke it in, or the leg that itself, the limb itself, is unused to this sensation of feeling graduated compression applied to it. So there is a risk potentially of infections in the toes in some clients. So if you're a client that has risky toes, like the toes always seem to get, dirty, potentially infected, the occlusive barrier effect of compression devices in the toe area may add to your risk of infection, and that may be mitigated by using toe-free compression. So this would be an open toe sock, an open toe stocking. So definitely talk to the lymphedema therapist that's prescribing the garment for you if in the past you have had repeated episodes of infections in and around the toe area. If you are having venous leg ulcers, this is important for you to understand that you need to include lymphedema expert in your venous leg ulcer treatment. Though you may be getting treated by the vein surgeon on the vein side of things, you still need to loop in someone with expertise in lymphedema. That is because ulcers rarely fail to heal because of the wound closing alone. The underlying lymphatic system is overwhelmed, so you also need to give treatment to that lymphatic system. Understand that venous hypertension is increasing lymphatic load, so you also need to address the underlying venous hypertension. And lymphedema management is needed to reduce edema, reduce inflammation, and reduce tissue fibrosis. So it's important to not just get wound care involved, not just the venous medicine expert involved, but also someone who has expertise in lymphedema, because lymphedema is part of this condition. And thinking about after the venous ulcer is healed, still use your compression garment. Researchers here publishing in 2024 stated compression significantly reduced ulcer recurrence at 6 months. So if you want the ulcer to go away and stay away, continue wearing compression even after the ulcer has healed. So let's talk about the main infections that happen that we're really concerned about in the limb, in the area of the body with lymphedema, and that is erysipelas or cellulitis. So we sometimes use these terms interchangeably. Technically, they refer to two separate conditions. Erysipelas affects the superficial skin layers. Cellulitis involves the subcutaneous tissue, but you'll see these terms used maybe in Europe, they use erysipelas more. In America, we use cellulitis more. But what we're talking about is this infection that happens and is particularly dangerous in people if it's in a limb or a part of the body that has lymphedema. So the article, Lymphedema Diagnosis and Treatment, shares with us 92% of lymphedema-related hospitalizations are linked to cellulitis. So this is what we're concerned about. Non-purulent cellulitis presents its erythema, warmth, edema, pain, often without fever. If it has fever, still go to the hospital. But if you're having this redness, warmth, swelling, pain, this is your signal to go and get whatever it is that's happening to the hospital to make sure that you are well taken care of. So what may happen? Antimicrobials like penicillin, erythromycin treat cellulitis and lymphangitis. And the most significant risk factor for recurrent erysipelas and cellulitis is lymphedema. So this is what we're concerned about. We don't want you to have episode after episode after episode of erysipelas, of cellulitis. And this is what you're potentially at risk for the more the limb is affected by lymphedema. And why we don't want this to happen over and over and over again is because each cellulitis episode causes further lymphatic damage and it increases the infection risk in a vicious cycle. So every time you get it, more injury to the skin, more injury potentially to the lymphatic system, more fibrosis, which puts you more at risk for a future infection in the future. So we want to stop this infection. We want to give you the information to understand what you're looking for in the rash, and we want you to go directly to in person to someone who can treat you at the hospital. Don't just wait for a telehealth appointment. Don't try to, go to sleep and see if it's better in the morning. If this is concerning you, it's an urgent call for you to seek real treatment. So let's talk about cellulitis and lymphedema and phlebolymphedema. So phlebolymphedema also has a venous component to it. And the incidence of cellulitis associated with lymphatic disease varies by the etiology of lymphatic disease, so why that lymphatic disease is there. And the phlebolymphedema has the highest rates of both an initial cellulitis episode and recurrent cellulitis events. Additionally, phlebolymphedema has one of the largest cellulitis-related total costs per patient per year. And prevention, as well as early identification and treatment of phlebolymphedema-associated cellulitis, could significantly decrease healthcare costs, improving patient quality of life. And I would also state it will help with you in your journey in longevity medicine to increase your health span. We want you to have as few cellulitis episodes as possible. We want you to have your phlebolymphedema well controlled so you can have a happy and healthy life. Compression therapy can be safely used in patients who have the erysipelas, who have cellulitis. So you're not taking off the compression because you have a cellulitis episode. Edema can be reduced by the compression therapy, which can reduce the complications. So part of this is a rash and there's more swelling associated with it. So we want the compression to help us control the swelling. And also compression may improve the penetration of antibiotics into the inflamed tissue. So we're going to the hospital if we have an episode of cellulitis so we can get those antibiotics. The compression is going to help our system get the antibiotics to the right place where they are needed in the body. If the cellulitis and erysipelas happens over and over and over again, you may be a candidate for liposuction, which also includes controlled compression therapy afterwards. So liposuction is not the same. It's not the same surgery as cosmetic liposuction. They're not taking the same healthy fat cells out of you. They are helping your body reduce the risk of future bouts of cellulitis and erysipelas. If you have lower extremity lymphedema, if you're having repeated issues with cellulitis and erysipelas, liposuction may be a treatment that may help you in the long run. So as we're coming to the close of this presentation, one clinical pearl on lymphedema and knee surgery. So if you know someone that has lymphedema, you have lymphedema, and the total knee surgery is in your future, it's important to become aware of what these researchers have shared in their publication in 2025, preoperative lymphedema. So having lymphedema when you walk into that operation is associated with an increased 90-day rate of periprosthetic joint infection and superficial surgical site infection. It's associated with increased wound complications and increased risk for pulmonary embolism after your primary TKA. So know that these risks are increased. Take the steps that you need to do to protect yourself. Let you and your surgeon have this conversation. Hey, I have lymphedema. Tell me what we're going to do. What is the plan to help me be as healthy as I can after this surgery? So as we close the presentation, I'll leave you with some longevity advice from me, from a lymphedema therapist. Understand that lymphedema is a chronic disease. We can't provide a cure, but lymphedema patients do deserve a better quality of life. So your lymphedema decongestion treatment, your lymphedema self-care that you're doing every day is focused on giving you a better quality of life. I want you to have as long of a health span as possible. Compression stockings alone are not the lymphatic care that our patients deserve. If all you're doing for your lymphedema is getting compression stockings, a new pair every 6 months, this is not the level of self-care that your body deserves for helping keep your lymphedema well controlled. Understand that recurring bouts of cellulitis, they compromise lymphatic flow. They're increasing the fibrosis. They are stepping you steps further down the path of your lymphedema becoming more serious. So we want to do everything that we can to stop and limit these cellulitis episodes. And understand that after infection control, you still need ongoing lymphatic care. We need to take care of that lymphatic system. And just a doctor giving you a diuretic is not proper lymphatic care. All right, so here are some of the resources that I used in this presentation. And I'd like to thank you for listening to my presentation. If you have any questions, if you want to follow me on Instagram, I'm at Longevity Massage Therapist, and follow me and get more content on longevity at my Substack, kathleenlisson.substack.com. Thank you and have a great day.